That's for today on a Wednesday. Nice to have you with us. And it's our medical show with our resident GP, Dr. Vicky Skitter. Hello, Doc.
Hello, Jeremy.
Nice to see you again.
Nice to see you too.
And it's one of those shows that I think you dread the most. It's when you throw questions at you that have been sent through to our email address. And we try and see if we can trip Vicky up.
I got my thinking cap on.
Yes, exactly. Back to varsity.
Yes.
Yeah. Ask the doctor. Vra for Vicky. Vicky is a vra. Okay, right. Let's start off with the one from Jenny. I'm having nosebleeds, she said. Is that a problem? Well, I would imagine it is.
It's not normal, okay, to have nosebleeds. So 60% of people will have nosebleeds at some stage, and only 10% of those is usually a problem, like bleeding disorders or inflammatory disorders. But the most common causes for a bleeding nose would be trauma. So if someone claps you on your nose, it's going to bleed.
Yes,
okay. But also if you scratching your nose, picking the nose, especially kids, that can cause it. Or foreign bodies. Kids put stuff up their noses all the time.
Yeah, true. You know that when I was a lighty, a friend of mine's mother had, my friend had a younger brother, and the mother smelled something funny around his mouth. And eventually took him to the GP. And the GP had found he'd pushed a pea or something up his nose.
Why is it always a pea?
I swear it had started growing.
Oh my gosh, yes, it can germinate.
It germinated.
It can germinate.
In his nose.
Okay, so yeah, it can be quite stinky. I've seen a few of those. Allergy can cause nosebleeds. Infection, obviously, as well. High blood pressure is quite a common thing, so one should have your blood pressure checked. Medications like blood thinners, cortisone nose sprays. So if you're on aspirin, lots of people take aspirin every day. That can cause it. Hot, dry weather can definitely cause it.
I've had the odd nosebleed.
It's very common.
In hot, dry weather.
Yeah. And then certain things in your diet, like certain preservatives, can also cause it, sulfur dioxide and stuff like that. So the treatment would normally be you sort of put pressure for 5 minutes on the lower part of your nose. 5 minutes. You can also pack it with stuff. You know what works very well is tampons. I had this one guy come into the practice once, this big, huge, muscular guy, and he had 2 tampons stuck up his nostrils. So, but it can work. But tissue will also work. And then, what you can do Vaseline. If you've got like dry, scabby nose, you can put some Vaseline or Bactroban up your nose.
The tampon.
Yes, and then the tampon. So that usually sorts it out. So it's probably best to go and see your local GP and see.
Darling, can I borrow 2 tampons, please? Oh, my goodness. Okay, now I'm moving on. I'm leaving it with the tampons. I can just see the little things.
Yeah, the strings hanging out. Oh, dear.
Gerald, in Durban, how often should you have your prostate checked? Now, these days, you used to have it checked
manually.
Manually, yeah. One of those where you
slap on the glove.
And every man dreaded that. But now they do it by blood test.
You know what? It's probably good to have a feel at some point. I don't really do that. The blood test is quite accurate. So usually when you hit 40, I would say, one should have a blood test done. I would do it yearly from then if you've got a higher risk. So if you've got a father or brother with prostate cancer, definitely every year. If your blood count is higher than 2.5 nanograms per milliliter, that's also an indication that you should probably do it every year. Very importantly, if you have symptoms. So the symptoms of prostate problems can be frequent urination, or when it wakes you up at night and you have to go to the loo all the time. When you don't empty your bladder properly, you're dribbling afterwards. That's also a problem. when it burns, when you urinate, erectile dysfunction is actually one as well. Then I would actually go and see the doctor. Now, if you have the blood test done and your levels are elevated or you've got those symptoms, you will probably end up with a urologist. So if you go and see the urologist, he would then do a manual examination. He'll do a prostate sonar, could do an MRI. They often do prostate biopsies when they're worried.
Okay.
So obviously from there on, whatever they find there, that's where the treatment will start. So you can sometimes just leave it when it's an elderly man. You're going to just sort of watch it a bit. They do radical prostatectomies. That's quite a big operation. They do brachytherapy where they put radioactive pellets into the prostate. That works very well. And obviously chemo and hormone treatment as well. But the most important message, I think, is, early detection can have 100% cure. So go and have your prostate checked. When last did you have your prostate checked?
Phew. Wanneer was het ek 'n vinger in my I actually don't know. I think it is over a year ago.
If you don't know, then you must go.
Yeah. Right. Fina in Gaborone. I am menopausal. What can I do about the sweating?
Oh my goodness. That is such a common thing. I get sweaty, irritated females. I'm one of them in my office all the time. So perimenopause, when you start becoming menopausal, whatever, it usually happens from between age 40 and 50, and that's due to the ovaries failing a bit. So your estrogen levels go down, testosterone, progesterone. So menopause, you can call a woman menopausal when they haven't had a period for 12 months in a row. Okay.
No, but you know long before that as a male. Because you guys get so irritated.
Absolutely. So usually what happens is that your estrogen levels reduce, and then what happens is you can get sweating or flushing because the blood vessels dilate. You get increased blood flow, and then everything goes red and hot and sweaty. You sometimes get palpitations, and sometimes it's followed by a cold sweat as well. But the good news is the sweating normally stops within 2 years. The bad news is it can often go on for like 7 to 11 plus years, which is a problem. What I suggest is obviously you can take hormone replacement therapy, but I think first try and go to bed in cool cotton pajamas. Maybe put a fan on or the aircon. They say a female should be sleeping at about 17 degrees Celsius.
Okay.
That's apparently the perfect temperature. So you can put the fan or the aircon, you can sip cold water. You must avoid triggers though. So the triggers could be alcohol, it could be spicy food, it could be cigarette smoking, caffeine. And then they say you must also de-stress. But there's this thing that they say, if you do deep breathing exercises for 20 minutes, about 2 or 3 times a day, it reduces your hot flashes a lot. But if I've got a sweaty, angry female looking at me and I tell her to go and do some deep breathing exercises, I think she's going to throttle me. Exercise, yoga definitely helps as well. And then I find it quite cute, actually. There's the fairy tale of Sleeping Beauty and the 7 dwarfs. So when
you read that and it stops you sweating.
No, Sleeping Beauty went through menopause and then she renamed the 7 dwarfs. She called them the 7 dwarfs of menopause, and their names were or are itchy, bitchy, sweaty, bloaty, sleepy, forgetful, and psycho.
I love the last one. Psycho.
So please be nice.
Harold, I suffer from tingling in my feet. A friend said I should be checked for diabetes. Now, how would those two be linked, if they are?
So when you have diabetes and it's not controlled, you can get what we call diabetic neuropathy, where you get nerve damage in your extremities. So you get your feet and your lower legs can become tingly and painful sometimes. So obviously it's also a common thing. Tingly feet, you can get it from sitting in the wrong position for too long, and then if it goes away, it's not a problem. But when tingling the feet wakes you up at night or causes pain or affects your walking, then obviously you need it checked out.
Okay.
So you'll check for diabetes, obviously. So other things that can cause it is an underactive thyroid, kidney failure, believe it or not. Pregnancy, you can get it during pregnancy, autoimmune diseases, vitamin B deficiency, alcohol abuse. Alcohol abuse can also cause neuropathies, okay? And then some medications like chemotherapy, that's quite a common thing, and antiretroviral drugs, that can also cause it. And toxins like arsenic, mercury, and lead can also cause it. So if you've got tingling in the feet and it sort of stays there, it doesn't go away, it's probably best to have it checked out.
Okay. And that you would do through your GP?
Yeah.
Okay. What do you think about asking a doctor for a second opinion, speaking of GPs?
You know what, it's a good question, because people often feel embarrassed to ask a second opinion, or they feel they'll offend someone. So I've got a good example there. I had a patient recently that was diagnosed, unfortunately, with breast cancer. And she went to the breast surgeon, and they've obviously got a protocol and a team. So they do A, B, C. And she obviously fell into the A category or whatever. So she was told that she has to have chemotherapy, that's it. And she said, well, you know, I really would like the surgery rather, isn't there a possibility? And the doctor sort of fobbed her off a bit. And I said to her, you know what, and the problem here is she's single, she lives on her own. So imagine she goes for chemotherapy, who's going to look after her? No one really listened. And the other thing is she just started a new job and she can't afford to miss time at work.
Yeah.
So she wanted to at least have the option or a discussion on, you know, what other options there would be, which I think was fair. So I said to her, get a second opinion, get a third opinion. So don't be shy. If you, it's not, you know, I don't feel patients don't trust me. I'm all for getting second opinions. Why not? It's your choice. It's your body.
Yeah.
So definitely ask.
Okay, last one. My child has a constant runny nose. I thought all children had constant runny noses.
Under the age of 5, probably. Yeah.
Yeah. Go wipe your nose. I still hear my mother shouting. What should I do?
Okay, so it's most common. Look, anything that causes inflammation or irritation in your nasal passages will cause a runny nose. So in kids specifically, the most common thing is a viral infection. And when they go to school, they get Crash syndrome and they've permanently got some kind of infection. But it can be infections, allergies also very common, and nasal polyps. Polyps develop if you have allergies untreated. So, and allergies can be to food or environmental, you know, whatever. So you can have that checked. Foreign bodies can also cause, like we've spoken about, foreign bodies. Pregnancy, you get pregnancy rhinitis. So it's very common for pregnant women to have a stuffy, runny nose. And as soon as that baby's out, the nose clears up.
Oh, really?
So the treatment for that is push the baby
Give
out.
birth.
Give birth. Stress can cause it, medications can cause it, anti-inflammatories, sometimes antidepressants, beta blockers. And obviously a runny nose from major trauma is going to be a problem because you can have a cerebrospinal fluid leak, but that's very uncommon.
Yeah.
So the most is allergies, infections and polyps, and you need to be checked for that.
Okay. Thank you, doctor.
Pleasure,
Thank you for
Jeremy.
your time. You passed your test.
Phew,
Yeah.
I'm sweating.
Dr. Vicky got an A. That's just because
Oh, that is the
menopause.
hot flash.
Thank you, Vicky, and thank you to you for watching. We'll catch you again tomorrow with The Motoring Show, right here on Mansfield Today.